Okay, so my 4-week project was medical terminology. My learning goal was to learn medical terminology. Um, my plan was to take the medical terminology class through iTunes U. The end results was that I learned new words, and I also got the meaning of words I have heard before because I do work in the medical field myself. So how I would take the class is I'd take it through iTunes U, and I have a little video of how you do that. Pretty much you're going to have iTunes open. Instead of being in your library and music, you're going to go down to iTunes U, and you're going to go to the store, and you can take any class you want over a variety of things, and the majority of the classes are free, and some of them you actually have to pay for. But I took the medical terminology through Liberty University. It was only 21 videos, but not all of them were lessons, and all you had to do was just hit get for one. And the nice thing about these videos, whereas I was able to pause and so it would just sit in your library and it showed which videos you have watched and which videos you have not. Okay, so the benefit of my lessons being a video is that I can stop the video and write down what she just said or anything I need to know. And then if I wanted to, I could also just go back to where that information was and re-listen to it to make sure it gets into my mind. So my project plan review is that I learned planning a big project. It's always stay on task. And if you are on a great staying on task person, you can get ahead of the game. Or if you're not a person that stays on task, aka me, you can get behind. And luckily, I did not get behind. I did not change my plan at all because my plan was based off of the class itself. So I had 5 weeks of the class, so I kind of just shortened it down to 4 weeks. Important things to know in medical terminology is that medical terms are mostly Greek and Latin sources. The words are technically codes, and you have to know the meaning of the prefixes, suffixes, and roots. Some of the words cannot be decoded, and there are some symbols, and they are used to translate. So patchwork and quilts, it's the main idea of how to remember the meaning of the words. So you always look at the suffixes, the prefixes, and then the roots. And the roots are the main core meaning of the medical term. And then you have the addition of prefixes and suffixes to the roots, which creates more of an understandable word. And some of the prefixes is that ology means study of, itis means you have like inflammation and all that stuff. Osis is a condition of, ia is also a condition of, and gram is like a written record. And here are the prefixes. An means no or none. Electro, it's just you can kind of get from it, it means electricity or it originates from electricity. And artho, it has to do with the joints. When you map your terms, so your body starts with the DNA, cell, tissue, organ, and organism. Words that define what direction and where are superior, inferior, cephalid, caudal, anterior surface, ventral, dorsal, posterior, supine, prone, costal, sternal, and substernal. So superior and cephalid both mean upper body. Inferior and caudal, they both mean lower body. Anterior surface and ventral both mean the front of the body, and dorsal and posterior mean the back of the body. Supine means you're laying on your back facing up, and then prone is you're laying on your stomach. Costal is the area of the rib, sternal is the area of the sternum, and substernal is below the sternum. And then you have 4 different quadrants of the abdomen, which is you have the upper right and left, and then you have the lower right and left quadrants. And here are some of the things. This kind of shows you the superior, inferior, lateral and medial, which is she did not talk about in the class. And here's proximal and distal, and then you have superficial and then deep. And those are like different ways where you map on the body. And here's also the interior and posterior. And then here are the quadrants right here, and then these are the regions. Okay, so the next one is skin. So we have 3 types of lesions. You have vascular lesions, primary lesions, and secondary lesions. Vascular lesions are made of blood vessels, so they're a type of shade of red. And then you have primary lesions, which are lesions mostly from like surgical. And then you have secondary lesions, and they're from healing from primary lesions. So primary lesions leads to secondary lesions. Now, a freckle is categorized as a macule, and a mole is categorized as a papule, and areola is a blister, and a pustule is full of pus. So it could be a blister, zit, a cyst, etc. Melanoma. So melanoma is cancer that is an abnormal growth of skin cells, and it develops most often where the skin is exposed to the sun, but not always true. There are 3 types of skin cancer. You have basal cell carcinoma, squamous cell carcinoma, and melanoma. And then to figure out if you have skin cancer, they use the ABCD rule. And here it just shows how they do it. So on the left side, you have a normal mole. And then on the right side, you have melanoma. Asymmetry, split it in half, you fold it in half, it matches the same way. And then border irregularity. The border, as you can see in the normal mole, you can see the border pretty well. In melanoma, it's kind of all over the place. And then color of the normal mole, it's one color. And then for the melanoma mole freckle, looks like, that has different colors. So the different colors could consist of different colors of tan, brown. Sometimes it's known to have red and blue in them. And then diameter, if the diameter is bigger, if it's 6 millimeters or more, there's a good chance that is melanoma. If it's smaller than 6 millimeters, it's a normal mole. So muscles. There are 600 different muscles in your body. Muscles can be extended and contract, and all resemble stimuli and respond to all kinds of stimuli. And all muscles are elastic. There are 3 different kinds of muscles tissues, and you have skeletal, which is you find them on your bones, throughout your whole entire body, really. And then smooth, you find them in organs. And then cardiac, which is you only find that in the heart. And these are the different type of muscles. So this one over here, this is the cardiac muscle. As you can tell, it's striated. It has these incarcinated discs in here, and that's how you know about heart. And this is the smooth muscle. It looks really smooth. And this is skeletal. As you can see, all the striations. Okay, bones and movement. So you have 206 bones in your body, and how we move is determined by our muscles and how the joint is put together. There are 3 types of joints. You have synarthrosis, ampharthrosis, and diarthrosis. So synarthrosis is, so these joints are allowed movement as preborns, and these joints are known as sutures. And when the baby moves through the birth canal, these joints overlap, and then after birth, they fuse. And then ampharthrosis is joints that move some way depending on where they are. So they might move very little, or they might be very flexible. And and most of the time you see that between the vertebrae and the ribs. And then diarthrosis is joints known as synovial joints. And synovial joints have a fluid called synovial fluid, and they also have bursa, which is a cushion for when the joints move, and they move in multiple directions depending on the joint. And there's like 2 different types of joints for diarthrosis, and you have hinge joints, which you find them in knees and elbows. And then you have ball and socket, which is hip and shoulders. So these are movements and angles that you can have with your bones. You have flexion, which is the angle becomes smaller. And then you have extension, which is the angle becomes larger. Then you have abduction and adduction. abduction is it's moved away from the body, so moved away from your midline, and then adduction, the joint moves closer to the midline. Then you have rotation, and it rotates on a central axis, and it must have one, so it's like your wrist, your ankle, and I believe your head is also considered on a central axis. And then you have circulation, which is it's end of the joint is fixed, and the other bones describes a cone. So dorsiflexion is you flex your foot, and plantar flexion means you point your foot, and then opposition is touching the thumb to all your fingers. So you have systole versus diastole. Systole is the high pressure system, and then diastole is the low pressure system. So when you get your blood pressure done, they always say like they say the number, right? And the highest number is the systolic number, which is the high pressure system, and they have the diastolic number, which is the lower number. Okay, and then mostly all tissues are supplied with oxygen during systole, and the pulmonary veins and arteries carry oxygenated blood to the heart after they go to the lungs. And the aorta carries the deoxygenated blood throughout the body. Penia. So the lungs have 800 million alveolar air sacs, and it takes 1.5 seconds for deoxygenated blood to move through the lungs and go back to the heart with oxygenated blood. This happens 100,000 times a day. Words that have the suffix penia are anemia, and that means no breath. Bradynemia, that's slow breathing, and medications can cause this, and it happens while you're sleeping. And then you have dyspnea, which is difficult breathing. And then you have eupnea, which is good breathing, so you want that breathing, and that's usually your daily basis breathing. Then you have trichonemia, which is hyperventilation, and this happens with anxiety, when someone's excited, when you're in pain, and when you have enthusiasm. Then you have orthopnea. People, when they lie down, they can't breathe. And so most people, they'll sleep because that means their head is up and they can breathe. It makes them easier to breathe. So why I need to know medical terminology? Well, I want to be a doctor when I get older. And so when doctors talk to the staff, like when you're talking to staff members, and they need to know what you're talking about, and you also need to know what you're talking about, because if you don't know what you're talking about, you don't know how you're going to actually take care of that patient. And it's also nice to know what is going on with the patient, which words can tell you. Words just make everything easier in the medical field. So the learning process was nice, because when I would just watch the lessons, I really didn't have to watch them, because if it's just the teacher talking, so I just could listen. All I had to do was listen. And I also learned that having the chance of pausing the video to write something down or just listening to it again was a huge benefit. There was really no problem solving with my project, since all I had to do was learn. This was really just based on learning, and it wasn't really make something come out of it. It was just to show you guys that I learned something. But if I could redo my project, I would choose a different subject to study on. And the most successful moment was actually figuring out what I was going to do for this last 4-week project I'm going to be doing. Having pretty much everything done was great. All I had to do was just take notes and make this PowerPoint up for you guys to show what I learned. And so I just want to say thank you for listening.